Welcome again. In this topic, we will review preoperative planning and patient preparation for Caesarean births. This includes informed consent, preoperative cares, infection prevention, and surgical safety. The risk of maternal mortality and morbidity is higher after a Caesarean section than for vaginal births. With increasing rates of Caesarean section, it is important to minimize risks to the mother as much as possible. In this topic, we will focus on different preparations to prevent complications and important preoperative cares. The first preoperative care that we will discuss about is informed consent. Obtaining informed consent is a process and not merely a medical document. The conversation should enhance a woman's awareness of her diagnosis and contain a discussion of medical and surgical care alternatives, procedure goals and limitations, and surgical risks. An informed patient may decline a particular recommended intervention, and a woman's decision-making autonomy must be respected. In the medical record, clinicians should document her reasons for refusal and should note that the intervention's value and the health consequences of not proceeding with it have been explained. Next, let's see some of the considerations that we should make while preparing a mother for Caesarean section. Regional anesthesia is preferred for Caesarean delivery, and an antacid is given shortly before regional anesthesia or induction of general anesthesia. An antiemetic like metoclopramide 10 mg intravenous is given in the 60 minutes before surgery. This minimizes the lung injury risk from gastric acid aspiration. A lateral tilt of about 15 degrees is suggested to elevate the mother's right side to avoid vena cava compression and supine hypotension syndrome. Intraoperative catheterization is not mandatory, and if performed, insertion should be considered when analgesia is established. If Caesarean delivery is scheduled, solid food intake is stopped at least 6 to 8 hours before the procedure. Uncomplicated patients may have moderate amount of clear liquid up to 2 hours before surgery. Enhanced recovery after surgery protocols advocate clear carbohydrate drinks up to 2 hours before scheduled surgery and early post-operative feeding. Since the risk of venous thromboembolism is increased with pregnancy and almost doubled in those undergoing Caesarean delivery, early ambulation for women without risk factors is recommended. Caesarean delivery is considered a clean contaminated case, and post-operative febrile morbidity is common. There are actions that should be undertaken to prevent these morbidities. A single dose of an antibiotic given at the time of Caesarean delivery significantly decreases infectious morbidities. Depending on drug allergies, most recommend a single intravenous dose of a beta-lactam antibiotic, either a first-generation cephalosporin like cefazolin 1 to 3 gram intravenous depending on weight, or ampicillin. For women who have an anaphylactic allergic reaction to penicillin, either metronidazole or clindamycin and gentamicin can be used. This should be given in the first 60 minutes prior to surgery. Adequate concentration in maternal and amniotic fluid samples are attained 30 minutes after administration. To prevent wound infection, preoperative preparation of the abdominal wall skin using either chlorhexidine or povidone iodine solutions is suitable. In studies that found a difference, chlorhexidine was found to have a slightly better effect. The abdominal surgical site should be cleaned with a chlorhexidine alcohol scrub with 2% chlorhexidine gluconate and 70% isopropyl alcohol. Povidone iodine may be used if chlorhexidine is not available. Here, the operator uses povidone iodine to prepare the abdominal surgical site. Vaginal irrigation immediately before Caesarean delivery reduces the risk of post-operative endometritis for patients in labor and patients with ruptured membranes. For this vaginal preparation, one should use 4% chlorhexidine gluconate vaginal scrub with a sponge stick for 30 seconds or 3 passes. Povidone iodine is an alternative option for this. Importantly, preparation with a high alcohol content, like chlorhexidine gluconate with 70% alcohol, used for skin preparation should be avoided in the vagina because alcohol irritates the mucous membranes. Pubic hair does not need to be removed, and if it is done, one should use hair clippers the morning of the surgery. The last point that we will see is surgical safety. Surgical safety is a protocol established to prevent surgical errors. In order to do this, all relevant documents are verified immediately before surgery and a timeout is completed. The timeout requires attention of the entire team to confirm that the patient, site, and procedure are correct. Important discussions also include introduction of the patient care team members, verification of prophylactic antibiotics, estimation of procedure lengths, and communication of anticipated complications. Furthermore, an instrument, sponge, and needle count before and after surgery is crucial to surgical safety. In summary, we have reviewed preoperative planning and patient preparation for Caesarean births, which includes informed consent, preoperative cares, infection prevention, and surgical safety. Next, we will discuss about basic surgical instruments used during Caesarean section. Thank you.